The ilium is a large portion of the coxal bone that appears in most vertebrates, including mammals and birds. The pelvic girdle consists of the sacrum, coccyx, ilium, ischium, and pubis. The ilium is the largest and most superior of the three bones that join to make the os coxae, or hip bone. It is located lateral to the sacrum, which is located at the base of the spinal column. The ilium is also an attachment point for many muscles of the hip and trunk. The ilium consists of the iliac crest, which is the most superior part of the bone. The iliac crest starts at the anterior superior spine and curves to the posterior superior spine. This is where the hands will usually rest when people put their hands on their hips, and forms the most prominent part of the hip bone. The iliac crest is particularly important in medicine due to the large amount of bone marrow it contains. The crest of the ilium is also considered to be safer than other locations, like the vertebrae, for harvesting bone marrow, and has the same type of quality. The sacroiliac joint is located on the medial side of the ilium and the lateral sides of the sacrum, which connects the sacrum to the ilium. The sacroiliac joint is held stable with ligaments and muscles, which limits its function. This joint has the ability to move about 2 to 4 millimeters in every direction, which is why it is considered a diarthrotic joint. This joint helps with the transfer of weight from the upper body to the lower body. Women tend to have a larger range of motion than men in this region due to mobility needed in childbirth. Sacroiliac joint dysfunction occurs through misalignment, and symptoms include lower back pain and inflammation in the joint. The anterior superior iliac spine and the anterior inferior spine are located on the anterior portion of the ilium and are bony projections inferior to the iliac crest. The anterior superior iliac spine is an attachment site for the inguinal ligament and the sartorius muscle. It also is an important landmark in identifying other clinical landmarks, including McBurney's point, which is 2/3 the distance from the anterior superior spine to the umbilicus. The anterior inferior iliac spine is an attachment site for the rectus femoris muscle and the iliofemoral ligament. The posterior superior iliac spine and the posterior inferior iliac spine are located on the posterior portion of the iliac crest and look similar to the anterior iliac spines of the ilium. The posterior superior iliac spine is an attachment site for the posterior sacroiliac ligaments. The posterior inferior iliac spine is separated from the posterior superior iliac spine by a small notch that appear as dimples on the lower back. The greater sciatic notch is located inferior to the posterior inferior iliac spine and superior to the ischium. This notch contains nerves, arteries, and veins, such as the superior gluteal vein and artery and inferior gluteal nerve. The superior portion of the acetabulum is also a part of the ilium, and it serves as the socket of the os coxae, in which the femur is located. The femur is attached to the acetabulum with a ball and socket joint. This joint is considered to be a synovial joint, in which the femur is able to move in many different directions. The iliac fossa is a smooth concave surface on the internal surface of the ilium. This fossa is the origin to the iliacus muscle, which helps to flex the hip. The fossa also serves as a cavity that houses reproductive organs. Iliac pain are signs of many different diseases or dysfunctions. A common pain is located on the right inside smooth surface of the ilium, known as the iliac fossa, is appendicitis. The ilium is an important part of the human body by serving as the highest point of the os coxae, and it also serves as the width of the pelvis.